Hey, this is Dr. Larson with Euphora Health. We're often asked what we do for specialty referrals because we are a direct primary care, and some people that use us don't have insurance. And so, in that situation, what I generally would say is that because I'm in a direct primary care as opposed to an insurance-based primary care model, this model really allows me to spend more time on the patient's care, both when they're in the room and when they're away from me. And so if there's a situation or a problem that I'm uncomfortable with, I can go spend more time studying and researching and trying to figure out the problem on my own. And sometimes that's sufficient for both me and the patient. And in those situations, we didn't need a specialty referral. This is kind of a situation where in insurance-based practice, sometimes they need a pressure release valve because they've only got 10 or 15 minutes to finish the visit. And if an issue, say like a procedure even, might take longer than that, referring to a specialist is kind of that pressure release valve so that they don't get into a situation where they're going over time. And speaking of these procedures, as a primary care physician, I'm trained to do dermatology procedures. I'm trained to do some orthopedic procedures, putting medicine in a joint, taking fluid out of a joint. And in these situations, I can do those myself as opposed to sending a patient to a specialist. So let's just say that we are able to do all those things, but that's still insufficient. Maybe the patient still needs kind of some specialty care. Well, there's another layer within direct primary care, and that is I can kind of go get the consult for you. I can either call close contacts that are specialists that I know and kind of get their tap into their knowledge to ask them this specific question: what should I do for this patient? Or if that's insufficient, we subscribe to services where we can tell the story for you. We kind of tell them your history, give them imaging, give them labs, any pictures that they might need, and within kind of 24 hours, they report back to us, answering our questions, whether those are questions on how to make a diagnosis or what treatment to provide with a specific diagnosis. And what I would say is in those situations, probably half the time, what might have required a referral before that consult no longer requires a referral. But even if you do require a referral at that point, we're often advised on what procedures or what labs we might do beforehand so that you walk into the specialist's office with all of those in hand. And it's a very efficient visit because you have all of the things that they're going to want, and they can kind of make a decision in that one visit and kind of move forward from there. So if even that's not enough and you do have to go see somebody, we've cultivated or curated a group of cash-based specialists that we could refer you to. And so examples of prices would be, an endocrinologist, a first visit would be $399. A neurologist, the first visit would be $185, or for rheumatology, it would be $499. Often we get enough information from them on that first visit that we're able to kind of take over care after that. But even if that's not true and you have to go back, usually it's not going to be very often per year, as long as we can figure out the problem, and the ongoing cash prices would be lower than the first cash price that you would pay. But if you have insurance and you want us to kind of guide your care within that insurance plan, we could certainly work that way as well. I hope you learned something about how we utilize specialists in our office, and if you have any questions, please post them.